Autism is a spectrum. Some people need more support than others, but to generalize and say none of us can work, date, or contribute to society is completely false. I have a job. I do pay taxes. I've dated. I have a master's degree. We don't need to be fixed. We need to be supported. But the answer isn't erasing autism. It's building a more inclusive world for all of us.
That was Danny Bowman, a cast member on Netflix Love on the Spectrum, speaking out against the characterization Trump Health and Human Services Secretary Robert Kennedy Jr. made about people with autism. RFK Jr., who Trump picked and Republicans confirmed for the nation's top health job, even though he has no medical or scientific degree, deeply upset people with his recent comments describing autism as a, quote, preventable disease, and saying that those with autism will, quote, never pay taxes, they'll never hold a job, they'll never play baseball, they'll never write a poem, they'll never go on a date. A Health and Human Services spokesperson later put out a statement that Kennedy Jr. was only referring to, quote, those that are severely affected. Earlier this week, CBS News reported that as part of Kennedy Jr.'s plan to study autism, quote, a new disease registry is being launched to track Americans with autism, which will be integrated into the data, including medication records from pharmacy chains, lab testing, and genomics data from patients treated by the Department of Veterans Affairs and Indian Health Service, claims from private insurers, and data from smartwatches and fitness trackers. As you can imagine, a proposal to create a registry of Americans with a certain condition and track their movements, medical treatments, and prescriptions, yeah, that's a five-alarm fire for people in the autism community and anybody else in America who cares about medical privacy. And tonight, HHS says, no, we're not creating an autism registry. Quote, a Department of Health and Human Services official said Friday that the health department is not creating an autism registry, contradicting an announcement made days ago by the director of the National Institutes of Health describing his plans to study causes of autism. We're not creating an autism registry. The real-world data platform will link existing data sets to support research into causes of autism and insights into improved treatment strategies. An official for the department told CBS News in an email statement the HHS official did not say whether the director, Dr. Jay Bhattacharya, initially misspoke or explain why his plan was reversed. Bhattacharya did not respond to a request for comment. HHS has not responded to a CBS News request for an interview with Bhattacharya about the registry. All this attention on Kennedy Jr.'s ignorance, when the reality is the biggest looming threat to children and adults with autism and their families is the Republican budget plan to slash Medicaid and Elon Musk's Doge chainsaw, which cut funding for education and autism research. Joining us now to discuss is Ashley Wiley-Johnson, Ph.D., no relation. She is a speech language pathologist and vice president of the Los Angeles Speech and Language Therapy Center. She's also the co-author of the book, Autism Spectrum Disorders from Theory to Practice, Assessment and Intervention Tools Across the Lifespan. Dr. Wiley-Johnson, thank you for joining me this evening. This is a very important issue to me, both personally and politically. And I just want to start with this. When you heard earlier this week, and April is Autism Awareness Month, when you heard earlier this week that the Department of Health and Human Services might be creating an autism registry, what was your first reaction?
You know, my first reaction, thank you, Jason, for having me on tonight, was nothing short of feeling alarm. And quite frankly, I felt like this idea of creating some sort of list to track people felt all too common historically. So I'm concerned about it, as is all of the people that I've spoken to in the autism community.
Now, Dr. Wiley-Johnson, one of the things that I think is important for people to understand is that while there are increasing numbers of people who have been diagnosed with autism in the United States, that is a reflection of better prevention and assessment, right? It's not necessarily some sign that autism is increasing, which is what conspiracy theorists like RFK Jr. are trying to promote, correct?
Yes. Well, of course, you know, we know that the tools that we have, the diagnostic understanding, our awareness and even acceptance of autism has definitely led to some of the increase in prevalence that we're starting to see. Of course, as a clinician, seeing this increase, which is pretty significant, it also is rapid, I am concerned. So I would like to see research continue. But it seems absolutely counterintuitive that we would take the money away from research when the need is to figure out more about what's going on.
One last quick question, Dr. Wiley Johnson. All of these cuts that we're seeing to Medicare and Medicaid, you have a center where you work with children and adults on autism, on the autism spectrum, helping them integrate into the economy and the society. What are these kinds of cuts to Medicaid and Medicare going to do to the families and the people who have autism in this country right now?
I mean, it is so detrimental, to say the absolute least. We are fortunate to be in a place where we're able to provide amazing services to individuals. I know when I see the moment when parents say this is really tough or this is hard on my marriage, it happens all the time. However, with access to services and support, like was earlier mentioned in the show, you see the trajectory and the life of individuals with autism change. You see the feeling of that never day go into, I have hope, or I'm excited for my child to reach these milestones. So to be able to take the money away when what we need is to change the access, allowing more people to come and get services, it's just unfortunate, to say the absolute least. And seeing this rise in prevalence rates coupled with pulling back from the critical services that we know help to support individuals who have autism, it's mind-boggling.
It is also a crisis of conscience, but that doesn't seem to be something that this administration cares about. Ashley Wiley Johnson, thank you so much for joining us this evening on The Last Word.